Sure. Great. So thank you very much, Andrew. And again, thank you very much for the speakers that were in this session. We've now slowly started to go from that core genome MLST that Fran presented on at the very beginning of our session 3, and we've now bookmarked it with some trends in Italy with some core or some STs there as well. So now it is my pleasure to start introducing our speakers that are invited from Public Health Agency in 4 different regions of the globe. We're going to start with Public Health England, and our speakers today are Frieda Jorgensen and Amy Douglas, who will do a presentation on what it looks, what some trends are from the Public Health England side. So please, Frieda and Amy, whenever you're ready, please share your screen.
Just in the meantime, lovely to see so many joining this event today. Thank you to the organisers for giving us this opportunity to share Campylobacter surveillance data from England. I will present on together with Amy Douglas. She works in the Public Health England Campylobacter surveillance group, and will present this with me in the next 10 minutes. So do you want to go on to the next slide, Amy? So we'll just have Amy starting with showing some historical trends and more recent data on the number of Campylobacter cases and something on outbreaks in England. I'll then follow this with reminding us of the outcome of the recent attribution study that Fran mentioned earlier today in England, and just finish with the most recent data on contamination found in retail chicken to perhaps illuminate some of the intervention activities that's been going on in England. So over to you, Amy.
Thanks, Frieda. So yeah, as Frieda said, I'm Amy Douglas. I'm an epidemiologist. I work in the National Gastrointestinal Pathogens Unit at PHE. So here we have a figure of Campylobacter laboratory reports in England recorded by the 2nd generation surveillance system. So that's our national laboratory reporting surveillance system. So there's some with sample dates between 1989 and 2019. And as you can see, it fluctuates over time quite a bit, but there's a general increasing trend. And while some of this will be due to improved detection methodologies, you can see that between 2009 and 2019, there are about 50 to 60,000 laboratory reports per year in England. So for gastrointestinal infections, we know that there are issues with under-ascertainment, and work conducted as part of the 2nd intestinal infection disease study in the UK between 2008 and 2009 estimated that for every laboratory confirmed case of Campylobacter reported to national surveillance, there are just over 9 in the community that go undetected. So when you consider the annual number of laboratory reports we record in the context of that multiplier, you can really appreciate how big the burden is. So here is a table of outbreaks recorded in the UK. So it's data from England, Wales, Scotland, and Northern Ireland. And one important thing to note is that all these outbreaks are local outbreaks. So while we have whole genome sequencing and PHE offers a routine sequencing service, less than 0.1% of isolates are routinely referred to the reference lab. So therefore, with the absence of this fine highly granular typing data, most cases appear sporadic and are not linked to as part of an outbreak. So they're not routinely investigated at the local level, and unless there is strong epidemiological evidence of an outbreak, sorry. So what you can see from this table is that chicken liver parfait is by far the most commonly reported vehicle. And what's very interesting is that last year, 2020, when COVID emerged, and then there were the following restrictions that we were all subject to in varying degrees. In England, in the UK, there were no outbreaks in which chicken liver parfait was identified as the vehicle reported. So that's quite striking. And it's possible that there was lack of capacity at the local level to investigate and report these outbreaks due to the demands of the COVID response. But it's also worth considering that events like weddings didn't take place for most of 2020 in England, so that's also a likely contributing factor. So following the emergence of COVID-19, myself and colleagues in the gastrointestinal pathogens unit worked with colleagues in academia at the University of Liverpool to examine the differential impact of the COVID-19 pandemic on laboratory reporting. And surveillance for each of the GI pathogens we cover was impacted in different ways. So we chose to compare norovirus and Campylobacter, so the two biggest bird and GI pathogens in the UK. And also they have quite different primary transmission routes. So in these figures, you can see at the top, we've got norovirus laboratory reports between October 2018 up to the end of 2020. And the bottom figure is Campylobacter laboratory reports. And you can see it's very different for the two pathogens. So for norovirus, which is person to person, there was a very dramatic drop and a persistent reduction in reporting, whereas for Campylobacter, it was acutely impacted during March and April, which is when England went into its first national lockdown. But it soon recovered, and actually by the end of the year, we saw laboratory reports return to levels that were comparable to the 5 years prior to the emergence of COVID. So while many factors will have contributed to these reductions, so it could be changes in healthcare seeking behaviour, testing capacity, healthcare provision, we know that many of the non-pharmaceutical interventions implemented to reduce COVID-19 are also effective, and what we would recommend for norovirus control. So the isolation of symptomatic individuals, the increased hand washing with soap and warm water, and also the enhanced environmental cleaning. So it's also likely there was a true reduction in norovirus transmission during that period. However, Campylobacter is foodborne, and it's clear to see that it never truly went away and still represented a significant disease burden during that period. So if we move on to more recent data, so here we have a figure showing the weekly number of Campylobacter laboratory reports recorded by SGSS. So those are the grey bars, and then the lines overlaid. You've got the red dashed line, which is the maximum number observed in that week in the 5 years prior to the emergence of COVID. Then you've got the bold line, which is the 5-season average, then the green dash line, which is the minimum. And then overlaid over that, we've got the dotted black line, which is the trend we observed in 2020. And what you can see from this figure is that throughout 2021, Campylobacter laboratory reports have been comparable to the five-year average, if not higher than the 5-year average. So in May, this year, we noticed, which is around week 19 on the figure, through routine surveillance, we noticed that it was trending rather high. So we decided to initiate a 3-month period of enhanced laboratory surveillance to look at this increase in more detail. So that ran from the 7th of June to the 31st of August. And that included asking laboratories across England to send isolates to the reference lab for whole genome sequencing, but it's also paired with questionnaires to collect the epidemiological information on those cases. So the work on this is ongoing, and there are no outputs available yet, but from this figure, it's clear to see that Campylobacter remains a significant cause of GI illness in England. And I will now hand over to Frieda.
Thank you very much, Amy. So as Fran mentioned at the beginning, the recent attribution study in England, I just wanted to highlight here, led by Professor Noel McCartney, now at University of College Dublin, attributed 75% of cases to the chicken reservoir, with most of the remaining cases attributed to ruminants, really. So because of this exposure from the chicken being the most important exposure, really, there has been a fair amount of activity in the UK to monitor the level of Campylobacter contamination, primarily funded by the Food Standards Agency. Next slide, please, Amy. Amy? Sorry,
it's not changing, and I'm not entirely sure why.
Oh, that's interesting. Oh, now it's coming. That's all right then.
Sorry.
So just really to review the level of Campylobacter contamination on chicken sold at retail stores in the UK has been monitored since 2014, where in 2014 the percent of highly contaminated chickens from the non-major retailers was higher than that from major retailers. So almost twice as high at 40% of the chickens that were sold in non-major stores compared to around 18%, 19% in chickens sold in major retailer stores. When I say major, I mean major supermarket chains. And the non-majors would cover stores such as butchers and smaller retailers and independents. And we continued over the years to see a decrease in the proportion of the chickens that were highly contaminated, indicating that there was a lower risk beginning to come for this type of exposure. In 2017, the contamination monitoring of the major retailers was seized from a competent authority point of view and was handed over to the retailers themselves. But the monitoring of chickens sold in non-major stores continued, and the proportion of chickens sold there that have more than 1,000 Campylobacters per gram skin is still around 11% at the time in 2020 when we had the last data. Sorry, next click, Amy. And just to highlight that we also measured the level of antimicrobial resistance in the Campylobacter isolates from these, with high levels in Campylobacter jejuni, coli, resistance to copafloxacin and tetracycline, but perhaps not really showing much of a change over the time frame we monitored. But the level of copafloxacin resistance in the isolates was higher than when compared to back in 2000. And really encouragingly, no resistance to gentamicin found, and low levels of resistance to erythromycin. Next slide, please. And just if you want to click through this, Amy, just to highlight, yes, the major retailers are publishing on their websites the proportion of chickens that what Campylobacter levels they have, and all of them at the moment seem to still suggest that the proportion is less than 7%, and in fact quite a lot lower than 7% on average for some of the outlets. However, we're not seeing the same level of decrease in the non-major stores. Keeping in mind what we just showed you about Campylobacter cases still being at a high level, it is perhaps one interpretation worth keeping in mind that had this intervention not taken place, the picture might have been even worse. And also keeping in mind that the level of fresh chicken sold in the UK could be increasing actually over this time frame as well, explaining this. But there's perhaps no doubt that compared to the original projection of what this level of decrease in exposure meant for human infection, that modeling perhaps would be useful to revisit. Sorry, final slide, Amy. So I think we spent our 10 minutes now. Thank you everyone for listening, and we're happy to take any questions later.
Thank you very much, Frieda and Amy. That was fantastic. So we'll move right along